That's kind of a wild, wild west scenario where doctors could just, if they wanted to, not saying that they do, but let's be honest, people like money, and it sounds like there's not really a whole lot of restriction on if you were to say file the same claim for the same person multiple times.
Talk about the fox in the hen house. Don't get me started on it. There's two sides to every coin, and oftentimes the truth's somewhere in the middle. But again, a lot of people out there that are spouting some of the things that we hear that are so antagonistic, or kind of just this is the only way it is. Everything, it's all bad. It's all a scam. It's all evil. You got to really look at who's behind that,
right?
And who's pushing what, because the other side of the coin, and one of the reasons Medicare Advantage is, it's not going away. It's not going to go away. We've seen all the fraud, waste, and abuse. Talk about it all the time, right? With Medicare,
certified every year,
right? And why is that happening? Well, there are no. Well, again, they're starting to add it. Why are they adding? Right? Exactly. Why
are they doing that?
So, prior authorization. So, doctor ends up billing something multiple times. You get a doctor who's in Florida writing a back brace for all these people in all these other states around the country they've never even seen. You start to do some research, and you start to see some of these people getting taken down for fraud, waste, and abuse, particularly fraud in the original Medicare space. Durable medical equipment happens all the time. My own mother-in-law worked for a healthcare provider. I believe they were neurologists, if I'm not mistaken. But people would come in, and every single person would automatically get a battery of tests. Like, we're talking like CAT scans, MRIs, like expensive ones done. Every person. And it was because of money. And that's the interesting thing to think about here is there's not really a check and balance on that side. So the provider they have a lot more freedom to put somebody through a gamut of kinds of different tests that may or may not even be necessary, and they get financially rewarded for that. You have to realize that.
Right.
On the contrary side, with an Advantage plan, or really any managed care plan, there are some hoops to jump through, yes, but it's designed to protect against fraud. It's designed to even help protect the patient from having to go through things they shouldn't have to. I mean, there's been numerous cases. You can do the research on it, and this would be great to actually have some context. But people that have been diagnosed as having cancer and put through chemotherapy, which is very, very profitable for providers, and it turns out they never even had cancer.
Wow.
Some of these providers they're in prison now, fortunately. Like, think about that. On the Advantage side, you have protections in place. There's documentation that has to be submitted for certain things to be done when you start getting to bigger items like that, which can protect not only the consumer, but also the insurance company, right, from paying out fraudulent claims.
Right.